Alright, so for this video, we're going to go over neural-dependent neurogenic symptoms and container-dependent neurogenic symptoms. So remember, there's no rule that it has to be just one. There could be both of these. But if it is just one, you want to make sure you're targeting your treatments appropriately. If it's both, you want to make sure you're addressing both of them. So this one, we're going to look at the radial nerve. But that does not mean that it can't be applied to other nerves in the body. One, it's an easy video to take, and a lot of the principles that we're looking at here apply. So for the radial nerve, we all know radial nerve testing. So let me have you hold your thumb there, Tony. I'm just going to do the most symptomatic way at first. This is not a video of the best way to do radial nerve testing or of all the steps. I'm going to go over the most symptomatic way at first if I want to be most aggressive here. So I'm going to come down here, I'm going to put traction on the shoulder, depress it there. I'm going to flex the wrist. I'm going to internally rotate. I'm going to make sure his elbow is straight. I'm going to internally rotate, abduct, and extend at the same time. Right there. It could raise the table, but then it would throw off the camera angle, so I'm not going to do that. And so, first I want to know if there's symptoms there. If there are, then the key is to determine, is it neural dependent or is it container dependent? Neural dependent means that we need to address the nerve. Now, neurogenic is different. So this is neural dependent neurogenic symptoms. So the nerve, if that's painful, the nerve is painful. Why? Do I need to affect the nerve or do I need to affect the container? So for neurogenic symptoms, I need to figure out if it's neural dependent. So if it's neural dependent, I need to do sliders, gliders, tensioners, something like that, something to affect that nerve. If it's mechanical pain, remember there's a lot of causes of nerve symptoms. You know, immune is involved. Could maybe some type of a radiation or chemical sensitivity. But if we're looking at this mononeuropathy, I need to know if it's mechanical, then I'm going to be doing tensioners, sliders, something there. If it's container dependent, I need to figure out which container and then I need to address those things more. So neural dependent would be if these containers are negative. Now, if you work on the containers and it gets better and it's still there, then we need to go more neural dependent. And you may choose to treat both of them at the same time if there is a little bit of neural dependent as well as the container dependent. And neural dependent techniques can help containers a little bit as well. But so container dependent, I want to look at palpation, manual muscle testing in the sensitized position, and accessory joint testing in the sensitized position. So we are going to go over palpation first. So I'm going to get back into that position. Hold your thumb there again, Tony. I'm going to go back there quickly for the sake of the video. And then, so first I want to know, I'm going to come around this way. I want to know, in the radial groove. I'm going to come back here posteriorly and palpate there. Find out if there's any pain there. Arcade of Frosch, right there. And then in the anatomical snuff box, right there. Those are the three spots I primarily want to palpate. And if any of those are more sensitive than others, maybe it's that neural container. Now I want to do manual, so that's the palpation. I want to do manual muscle testing. So I'm going to bend the elbow just a little bit. Actually, I'm gonna keep it straight. I'm going to try to bend your elbow. Don't let me. So I'm going to try to bend that elbow. If you get it or if you don't, maybe I lost a little bit of this. This is where it's nice to have 3 or 4 hands. Maybe you get a technician or somebody to keep holding that, or a student. You keep it there. Now try to bend the elbow. I'm going to fight that. Actually, I said I'm going to try to bend it. He's going to try to keep it straight. So I'm going to try to bend it. He's going to try to keep it straight. So then we're using the tricep. Now, I'm going to have you try to straighten out your wrist when I ask you to. Okay, try to straighten out your wrist. Okay, rest. Now you're going to try to move your wrist that way, okay? Go. Rest. So that's manual muscle testing in the sensitized position. Now we want to do accessory joint mobility testing. So I could get in this position, I could test the C5 through T1, see if any of those sensitize it. And so if I did that, I'd have somebody hold that there. And then I would come in here and I would just do lateral glides there. See if any of those is more sensitive here. But also, when I get in this position, traction at the shoulder a little bit. Remember, the radial nerve starts in the axillary space there. And then I could also, in that position, I could test the radial head. And then also I'd come down here and work on the carpals in that same position. And see if a traction position right there at the scaphoid produces any symptoms or decreases any symptoms. So that, let's review those. We did palpation, manual muscle testing, and accessory joint mobility testing, all in the sensitized positions. Now, do you have to do these every single time? No, this is when we are not sure. Sometimes it's an obvious presentation. But when if it's not obvious, sometimes in evaluation, sometimes they've been progressing and they plateau, or they're not progressing as we expect. That's when we need to get more detailed. These are principles based off of Butler's The Sensitive Nervous System book. And there's not a lot of any research that I know that specifically tests the validity of these. But this is when we're struggling, and if we had good research that told us how to treat every single one of these patients, and without this, then we wouldn't struggle with any of these patients. These are the patients that we're struggling with, and we need to identify more specifically something that can help us. If all of those container-dependent presentations are negative, then you want to aggressively go after remodeling that nerve or decreasing the inflammation of that nerve, whatever pain mechanism you identify is present, and working on the nerve. If it's container-dependent, work on that container, wherever it was tender to palpate, or which muscle hurt more to contract in that sensitized position, or which joint changed their symptoms when you were testing it. Whatever you determine is impactful for them, make sure it's reproducible. What you don't want to do is have one thing be painful. You go treat it, come back, it's not painful. Was it really what you did, or is it because you tested it a little bit different? You want to make sure that at least 50% of the time you test it, that it actually does change their symptoms. If it's only occasional, then it's not a positive test. You want it to be over 50% of the time you test it before treating. So if you test it 4, 5, 6 times, make sure that at least 50% you're getting a positive finding. And then you'll know when you retest it if you've actually made a difference.